Good evening, Eagle Nation. Welcome to the third series of Your Health Matters, our Black History Month edition. This evening we have Mr. West, Mr. Marcus West, and Dr. Jacqueline Hairston from the Department of Health to talk to you more about diabetes and give you a little bit of COVID-19 updates. So no further ado, I'm not going to hold up their time, I'm not going to hold up my time. I'm going to turn the Zoom screen over to Mr. West and then to Dr. Hairston.
Thank you for having me today, Mr. Davis. And I want to begin by sharing my screen, but also setting the tone for today's presentation. So start by first sharing the screen and try to make this full screen and present. So I guess I'm going backwards. So we're going to go ahead and start with connecting the dots, COVID-19 report. And the reason why we're going in this order is what we're going to see is that a lot of the comorbidities that I'm going to talk about also relate to wellness and are closing the gap in SNAP Ed programs, which she's going to be doing a presentation dealing with heart health and some other things. Not to speak before her, I want to go ahead and speak on connecting the dots to her presentation. So the title appropriately says COVID-19 Connecting the Dots. My name is Marcus West. I'm with the Florida Department of Health in Leon County in the Division of Community Health and Planning. And I'm accompanied by Dr. Jacqueline Harris, who is our CHIP manager, Community Health Improvement Plan manager with the Florida Department of Health as well. And she's also over some other things, and I'll let her speak about that. So first want to start, and I don't know if my full screen is shown, but I'm talking about the COVID cases. So I know there's some people who live in Leon County, and there's also some that live in Gadsden. So just to be fair for both of those, since that is our sister city, I wanted to provide data for both cities, depending on, it doesn't matter if you live, work, or play in Leon or in Gadsden, you should have access to this information. So these are the total cases for Florida, the US, and globally. And this is how this is where we line up with this locally. So Leon County, we have about 28,000 cases, of which 28,000 of those are residents, 28,885 cases total, of which 28,041 are residents. And we've suffered 277 deaths. Within Gadsden, we had 5,401 total cases, of which 5,385 were residents. And this resulted in 83 deaths. So these are our numbers. This is what we're dealing with locally. And again, the state, the nation, and the global numbers are adjacent to the left. So we want to look a little bit deeper by zip code and population so we can get more of an accurate representation of how these cases display in specific areas. And what we saw was that out of the 5,401 cases in Gadsden County, zip code 32351 and 3233 had the highest number of cases. And I don't know if you can see that on my screen, it's cut off. But when we looked at Leon County, we had about 28,885 cases. 32304 and 32303 had the highest number of cases. So, and this kind of gives us the breakdown. And we looked at the population so we can come up with a rate of cases per 100,000. So when we looked at the 32303 zip code, we see 1,000 cases. And then we looked at 32351 and we see about 2,000. When we look at 04 in Leon, we saw 6,000 cases, and 03 in Leon, we saw 4,000. So just to kind of give us perspective of where some of these cases lie. So when we look at the data for in the previous day for Leon County, 2,253 residents were tested, of which 81 of those were positive. 2,172 were negative. So the previous day, we had about a 3.6%, and we want to make sure we stay under 5% as a standard. So total Florida residents tested, 2,253, which gives us, again, that 3.6% positivity rate. This is where we begin to connect the dots. So why is COVID-19, what all this talk about social determinants of health, comorbidities? So the takeaway from this slide, there are a lot of words on here, and I want to give you some focus as it relates to looking at the words social determinant of health. So when we look at economic stability, neighborhoods and physical environment, education, food, community, and social context in our healthcare system, we understand that people who are a minority or underserved, people who are living in poverty, those individuals who might not have access to quality healthcare, they are dealing with sometimes several of these factors, whether it's economic stability and education, lack of education, or food insecurity. And again, for each of these columns, you see there's different things in which these individuals can be suffering or dealing with each column. The main takeaway is, as you have a compounding, or as you deal with multiple categories and you deal with the problems within multiple categories, they begin to impact your health outcomes. So they begin to, as you have increased economic instability and increased food insecurity and a lack of access to healthcare, then you have increased mortality, increased morbidity, a decrease in life expectancy, an increase in healthcare expenditures. And so these are different things that we're looking at to kind of see what should our focus be. So if the house is on fire and we have different resources as it relates to COVID and other health programs, we don't want to just show up to a house that's burning and spread with water. Meaning you want to make sure you're putting out the side of the house that's on fire. That's why we looked at the zip codes to know what the problems are. That's why we look at health equity to make sure that the parts of the house that are burning are receiving the water. And we're making sure that everybody that lives, works, and plays in Leon County has the access or the same opportunities as we look at equity to be as healthy as the healthiest person, the most affluent person in town. So regardless of your ability to address your barriers, we want to make sure that you still have the same opportunities as individuals who do not have said barriers. So demographics, when we look at Gadsden and Leon in Florida, we do see that in Leon compared to the state, we have 31% of our population being African-American or Black, but Gadsden County is 55.8% African-American or Black. And that's compared to 16.9 for the state of Florida. But when we look at Caucasian Americans or white counterparts, 77% of Florida is white. Leon County, 61.9%. So in Gadsden County, 41.7% of its population are Caucasian or white Americans, compared to 55.8% being Black. So we also want to look at the Hispanic rate. We see a higher percentage of Hispanics in Gadsden compared to Leon, but then we have less Hispanics in Leon and Gadsden compared to Florida. So I wanted to make that comparison. And why is that important? Because studies show that if you are African-American or of African-American descent and you contract COVID or you have an incident of COVID, you are more likely to have a severe infection that will result in you passing away comparative to any other ethnic or racial group. But Hispanic Americans or Hispanics, it's been shown that if you are of Hispanic descent, you have a higher likelihood of actually contracting COVID. So there's more prevalence in the Hispanic community. More people who are Hispanic have a higher likelihood of getting COVID. But if you're African American and you get it, you have a higher likelihood of passing away from it. So again, just looking at some of the equity, talking about the haves and the have-nots. Why is this important? Because we want to make sure that regardless of your ability to afford quality healthcare, that you have access to it. So we looked at things like median household income, and we saw that there were some disparities between Blacks and Caucasians within Gadsden and Leon County. When we looked at median income, when we looked at poverty percentage, we saw a higher percentage of Blacks and African Americans in poverty in Leon and Gadsden compared to the state of Florida, and also compared to their Caucasian counterparts. Same thing with median income. When we looked at individuals 25 and older with no high school diploma, we saw that there were some disparities there, and also with high school graduation rates. The reason why we looked at these is because we're looking at COVID not just as a health not from a health perspective, but we're looking at the social economic factors that would cause people to be at greater risk than others. So if you're a frontline worker, if you're an essential worker, if you're working some of those entry-level jobs that are competitive in Leon County, because our job market sometimes, depending on who you talk to, they say it's oversaturated because we have a lot of employers, but then the same employees, to pull from it, then the same employer say they can't hire somebody. So when we look at those entry-level jobs, we want to make sure that those individuals who are working our fast food, our service jobs, that we're considering them when we think about COVID and exposure. So ability to pay for healthcare. We do see that in Leon County, those who could not see a doctor at least once in the past year, we had lower percentages due to cost. We had lower percentages compared to the state. But when we look at each ethnic group, we did see that there were some disparities linked in. Excuse me, let me move this so I can see. So when we looked at our Hispanics, we saw that there were a higher rate of percentage of people in both Gadsden and Leon that could not go to the doctor because of pay or cost associated with it. When we looked at Blacks, non-Hispanics, there were less in Gadsden that could not go, but Leon County actually exceeded the state's rate. So at 21%, there were more individuals who could not see a doctor due to copay or the cost compared to Florida and Gadsden County, respectively. Healthcare access. Do you have a personal doctor? It's important to have a primary care physician. The reason being, when we look at comorbidity, COVID, we're looking at chronic conditions. So people who are not going to their primary care, they're not checking their A1C, they don't know they have diabetes, they don't know that they're at risk. So it's important that you go to your primary care provider so that they can do these screenings on you and make sure that you do know if you have any comorbidities, anything else going on, but also it's just good practice to seek out care from a primary care physician. So when we look at these numbers, we do see that compared to the state of Florida and all racial groups, except for Hispanics, well, and that's even close for Hispanics, but more people in Gaston and Leon have a personal doctor than compared to the state of Florida. So that's actually a good indicator for us because right now, vulnerable conditions are going through the primary care and the federally qualified healthcare centers for vaccinations for COVID. Health factors, again, we're looking at people who smoke, we're looking at obesity, and we're looking at those who are not active. So these are some of the numbers associated with that. We see people who smoke in Gadsden. African Americans are less likely to smoke than their Caucasian counterparts, and they're less likely to smoke than the state of Florida. In Leon County, it looks like, based off of the statistics, that African Americans are smoking just a little bit more than the state of Florida, but Leon County's rate actually is lower. So Leon as a county, we have less people smoking than the state of Florida, but we are saying that African Americans are smoking more. Adults who are obese, we do see a higher percentage. Look at the difference. 57% of those who are African American in Gadsden are obese compared to 27% in the state of Florida. And then 40% in Leon County compared to 27% in the state of Florida. And then also those individuals who are inactive, 56% of those in Florida have insufficient activity. We're looking at 64% of African Americans in Gadsden and 55% respectively. So African Americans in Leon are more active than the state range. But again, and a caveat to these numbers, just because the state has a number at 56%, that does not necessarily mean that we should use that number as the status quo. That's just something for us to use to measure against the other 67 counties. But again, the state might not necessarily have a great number when we look at it as an indicator compared to the nation or compared to a global number. So keep that in mind when we look at these numbers and we're making comparison. It's for us to be able to have apples to apples, not necessarily saying that the state rate is the status quo and that's what we should be aiming for. We definitely don't want to be below it if we're looking at that, but we might want to exceed the state rate in certain areas. Food insecurity. This is one that we do not want to exceed the state rate in. And we have. So when we look at food insecurity for Florida, 13% of Floridians are food insecure. Gadsden 22% and Leon 19.7% are food insecure. When we look at our child hunger rate, Leon County our children are less, we have a lower child hunger rate or child food insecurity rate than the state of Florida at 19, 1 point less than the 20.4. But Gaston County is at 25.3. So 25.3% of children in Gaston County are food insecure. This is important when we look at lack of resources because of COVID-19. A lot of these food drives, you see a lot of fancy cars that would not normally be in line for these food drives because COVID-19 has no respects to title. And there are a lot of people, regardless of your social economic status, that are being impacted by this. So this is something for us to keep on the front of our minds as we think about equitable distribution of resources. Now you have people who have never been middle class or in poverty that are competing for those same resources. So let's think about how that will play out as we look at distribution of both medical and non-medical resources. Our selection matrix. So just to make sure that we were equitable, we looked at all of those comorbidity, all of the comorbidity data, and we came up with a process to make sure that we were equitable in testing for COVID. So we looked at demographic indicators. We looked at comorbidity, high blood pressure, cancer, asthma, all of these things, some of which Dr. Harrison is going to talk about in her presentation. And we came up with a process for testing and selecting testing sites. So these were some of the zip codes that we selected as far as in Leon County based off of the matrix that I was just going over. And then Quincy, these were some of the zip codes that were focus areas of concern. And these considerations are also being taken as we look at vaccination and deploying vaccines in Leon County. So I wanted to also show you, because it's Black History Month, those individuals who are Black and 65 and older, because right now, based off of the executive order, that is our lane as the health department, we are vaccinating individuals who are 65 and older. So the total population, again, in Leon County is about 300,519. Those who are over 65 only represent 41,751. Number of people age 65 and over that have been vaccinated as of the 23rd of this month, we're at about 28,000. So the percentage for all races, percentage of 65 years and over of all races makes up about 13.9% of Leon County's population. Percentage of Black people 65 and older vaccinated as of today, 68%. That's the percentage of people total in Leon County that have been vaccinated today. So 68% have been vaccinated that are over 65 and older in Leon County. African Americans that live alone that are 65 and older, there's about 8,337 of them. And the number of Black people 65 and older that have been vaccinated, there's about 2,691. So based off of those figures, just out of African Americans that live alone and African Americans that are 65 and older, about 32% of those individuals have been vaccinated when we're looking at individuals who are 65 and older that live alone that are not African American. 68% of those individuals have been vaccinated. So we do see a disparity between 65 and older that have been vaccinated and African Americans that are 65 and older that have been vaccinated. This could be due to vaccine hesitancy, which I've heard and encountered some of that, but it also could be due to the lack of access for a vaccination. And I've heard that argument too. So I want to share some information with you guys so you can help me get the word out in the community about places people can go for vaccination and testing and other resources. So we look at the zip code again, because again, we want to know where the problems are within our system. So where's the need, so we can know where the greater resources need to go. And again, here's just some numbers of people who are 65 and older, the African Americans that are 65 and older that live alone, and then those who have been vaccinated. So these are some percentages to go with certain zip codes. And these are estimates, again, based off of Florida shots and some data systems. So again, these are not concrete numbers. They're changing fluidly throughout the day, but this is what a point in time assessment. So I wanted to kind of show what was going on in town as far as providers before I get to my last slide and transition to Dr. Harrison. So Blacks and African Americans 65 and older in Leon County residents vaccinated by a FQHC. Anytime you see that, that means a federally qualified healthcare center. That's going to be Bond Community Healthcare Center, Neighborhood Medical Center, and North Florida Medical Center, of which you can see the number of people who were vaccinated at the time of this report being pulled. Florida A&M University is also beginning vaccinations, but this might not represent on-site vaccinations for them at this time. They're actually going to be going live with vaccinations tomorrow, I believe. But again, I'll wait for the official messaging to go out to confirm that. So people 65 and older vaccinated in DOH-Leon. So these are the people who are vaccinated specifically at the Department of Health in Leon County. So in December, we had about 84 people, January 2002. And then in February, we vaccinated 5,823 people for a total of 7,909. That's just at our site. And again, these are estimated numbers based off of raw data that was pulled. And then Black people who are 65 and older vaccinated at DOH. So then again, just looking at if there's a disparity, we see 12 people in December, 107 in January, 304 for a total of 459. And these are vaccinated at DOH Leon, not within Leon County, but specifically at our facility. So we see out of 7,909 people, only 459 have been African American. Based off of this report. So we definitely are concerned about that when we see that number, and we want to make sure that it's not as a result of either vaccine hesitancy or the lack of access. So with that being said, there are some recurring vaccination days and outreach. Bethel Missionary Baptist has been doing vaccinations, but their dates are tentative. They just did a clinic, and they probably, have another one coming up soon. Then we have the reoccurring FQHC vaccination days. So these are days throughout the week that North Florida Medical Center is going to be vaccinating. And that's Tuesday and Thursdays on site at their facility. They're going to be rolling out second doses in the end of this month. Bond is actually doing vaccinations on Wednesdays and Saturdays, and Neighborhood Medical Center is doing vaccinations on Wednesdays and Thursdays. Also, for testing sites, you can always go to the Leon County Florida .gov website. And I have this here so that I can show this to you briefly, and then we're going to switch to Dr. Harrison. Stop sharing, share screen. And we're going to go straight to the Leon County website, share. And this is a great resource for a lot of things COVID. It does link back to the Florida Department of Health's website, but it's very good for pop-up sites. So if you click on this website, and I provide the link within the PowerPoint presentation, and this not only gives you some insight or some information about COVID, it also shows you some resources within town that you can go to, or you can click on it and it leads you to other pages. So what should I do if someone in my house has been exposed? All of these frequently asked questions that are from the health department, and it has a link to our Stronger Than COVID-19 or C19 mobile app. It also goes over the symptoms. What are the symptoms? What are symptoms for COVID-19 in pediatric patients? So it's a lot of great resources, but the most important part for tonight's purposes are the COVID testing sites in Leon County. So the latter part of the bottom half of this website shows the pop-up mobile testing sites and free community ongoing testing sites. So I wanted to show this. It also goes on to Patients First, CVS, and a couple of the other sites in town. And it tells you how to register and also where these places are and a little information about it. But I don't want to belabor the presentation any more than I need to. I thank you for your time. And I want Dr. Harrison to kind of take it away and speak to how if you take care of yourself prior to getting COVID, you have a better chance of dealing with a COVID infection. So those comorbidities that I talked about, Dr. Harrison is going to talk a little bit more about how your lifestyle or things within your lifestyle or the lack thereof can actually lead to you being more at risk or more at risk for a COVID infection or more at risk to succumb from a COVID infection. So again, I want everybody to be safe. Please make sure you wear your mask, wash your hands 6 feet apart, and listen to Dr. Harrison, because she's going to tell you how to make sure that you have the best chance possible with a natural defense against this virus. So thank you for your time, Dr. Harrison.
Oh, wow. I don't know if I can follow you, but anyway, thank you, Mr. West. I think you've probably covered everything that I was going to cover tonight. So this conversation is over. No, ladies and gentlemen, I am, as Mr. West has said, the Community Health Improvement Plan Manager for Leon County. I wear several hats. I've been fortunate enough to be here and learn under the tutelage of Mr. West. A lot of things coming out of grad school as a PhD in public health and not having that experience, he has really provided those opportunities for me. And tonight, you all inviting me here, it expands my horizon even further. So I want to say thank you to everyone that thought about me and giving me this opportunity. That being said, I'm still seeing your screen, Mr. West. Um, is that, is me going, I can share now and it'll take yours out. Let me see what happens here. Uh-oh. Okay, let's see what it's telling me. Okay, guys, let's go for this. See if I've got the right one. Okay. All right, can everybody see my screen now?
No, ma'am.
No. Oh, that's not good.
So Mr. West has to
Okay, he has
stop
to.
sharing his screen.
Okay. That's it. Okay, so let me unshare, I guess, mine. No, it never did. Okay. Is he, Mr. West, are you there? I can't get through until you take your screen down. I don't think so. Okay, can you see me now? Can you see my screen yet?
It's up. Yes, ma'am.
Okay, awesome. All right. It should be full screen. And is that what you guys are seeing, or you're seeing my tabs?
Full screen.
Okay, awesome. All right. Well, not only I believe, as Mr. West said earlier, I'm one of those experts in diabetes because I've personally had to deal with it. I got a diagnosis in 2000, and I had to change my life, my lifestyle, so that I could be here. I have lived long enough to see grandchildren grow up and graduate from high school. So I'm grateful to God for that. I entitled this Fight for Your Life. I also had to deal with COVID in December, and it's a beast. And I'm glad that I was able to get some health care. There's been times when I did not have health care. And so with that, I probably would have had a better chance of not getting sick had I been able to do what I needed to do. But it's okay because I'm still here and I can tell y'all about how to fight for your life when you're dealing with diabetes. Uh-oh. Uh-oh. Mr. Davis, your hand's up. Did you have a question?
No, I was just clapping.
Oh, thank you. All right. Appreciate that. So some of the learning goals that I hoping that I'll be able to get across to you guys is to how to identify negative health impacts. There will be several, at least three diseases that will impact your life. It will cause you to have all kinds of problems. And they are some of the three issues that people with COVID, based on my research, are having. And I'll point those out to you. They're dealing with that, and COVID is not helping any. I'm gonna identify beverages with high sugar content. I'm gonna help you understand the harmful effect of these drinks, share alternatives, lifestyles, ways that you can improve what you eat, that will give you natural defenses to assist you in being able to fight this disease. And then also share productive strategies to reduce consumption. So If we don't eat it or drink it, it'll be better for us, especially those of us living with diabetes and some of those with the different steps like pre-diabetes. You go to the doctor or you start to feel bad. You can also contact me and Mr. West because we have resources where we can get you some help on making sure that you know whether you are dealing with diabetes, or if you are, how to get you some help. The silent killers, I just talked about 3 main diseases that are causing harm when it comes to people dealing with diabetes or comorbidities that are giving patients or individuals a hard time and making them predisposed to COVID-19. One of them is heart disease. As of 2014, about half, which is 49%, and I look for some updated numbers for you guys, but it's been hard to find them. So I stuck with this. They have at least one of 3 key risk factors for heart disease: high blood pressure, high cholesterol, and smoking. The high blood pressure and the high cholesterol, it'd be a good idea to at least come to one of our health departments, see a medical provider, or go to one of the clinics in town and just periodically check. There are different places around town for checking your blood pressure for sure, but your cholesterol, you're gonna probably have to have a healthcare provider help you with that. High blood pressure, that is a huge issue. And 40% of Floridian or Florida adults reported having high blood pressure. That's, I didn't put my state figures here. I condensed my PowerPoint so that I could get us through this a little faster. So if you need some more information on that, more statistics, please by all means contact me. My information will be at the end of the PowerPoint. Diabetes, what we're here to talk about. In 2015, 2016, Black adults had a higher average annual prevalence of diagnosed diabetes than other racial ethnic groups. Asian adults were less likely than other racial ethnic categories to be treated with insulin injections. Most of them were able to take the pills or different other types of ways or medications to help them to deal with diabetes. And then white adults were generally more likely than their minority counterparts to report having received the recommended monitoring tests. So like you go and you get your A1C, all the different tests that doctors check your kidneys, your liver, and all of that. Most of them more than likely, based on the data that I have, and I got this from, would present because they were concerned or they were with a healthcare provider of some sort and they were called in to be monitored with these tests. All right. This chart goes along with figuring out what percentage of adults age 18 and older reported diagnosed diabetes by race, and they went along with what I just said a few minutes ago. The 2015-2016 report that the Agency for Healthcare Research and Quality presented, and they have a survey that they do. I don't know when the next one is. I was at their website and I found this one, and this was the latest. So it showed that all of the demographics, it was 10% that presented and was diagnosed with diabetes. However, it shows here that 13% of those Blacks and non-Hispanic was the highest of all the different ethnic race and ethnicities that presented out of white, Hispanic, and Asian non-Hispanic. So it still shows that we have a significant problem. The Hispanics were kind of, it seems to me from the statistics, they just sort of leveled off in that category of all. Diabetes is a global issue, but a lot of it has to do with obesity and what we eat and what we drink. Obesity has nearly tripled globally since 1975. In 2016, more than 1.9 billion adults 18 years and older were overweight. Over 650 million were obese. And this is just startling. If you're talking about 2016, we're in 2021 now. I was not able to find my figures, but I will keep looking so that I can update this. 39% of adults aged 18 years and over were overweight in 2016. We got that. 41 million children under the age of 5 were overweight or obese in 2016. With COVID and people being sheltering in place, I can't even imagine what between now and the end of 2021 that I'll be able to pull the figures to see how I can only imagine that has drastically changed. Over 340 million children and adolescents between ages of 5 through 19 were overweight or obese. That is a lot of people, and we're talking about global. In the US, however, by 2030, 42% of all adults will be obese. That's, wow. Okay, so they're saying almost half of us, costing an additional $550 billion in healthcare expenditures. Our nation is in the midst of a public health crisis so profound that is undermining our national well-being, our economic competitiveness, and even our long-term national security. And that was before the pandemic. In 2012, that article was written. In Florida, more women, 39% than men, 34.7% in Florida are obese. Among racial and ethnic groups, Blacks have the highest obesity rate. Overall, obesity rate of 45.7% for Blacks, followed by 37.1% for Hispanics and 35.2% for non-Hispanic whites. There is significant geographic variations in Florida's obesity rates. A handful of counties had obesity rates between 25% and 29.9%. More than 10 counties had obesity rates over 45%. The highest obesity rates were in the central, northern, and panhandle counties. Obesity, the cost. As of 2018, the prediction is that obesity costs more than $14 billion. By 2030, could increase to $27 billion. Obese people are more susceptible to injuries and decreased productivity. Chronic diseases such as diabetes, high blood pressure, and heart disease affect many of us, and obese people will have a shorter lifespan, according to the American Heart Association. That brings me to how I can explain to get us to a place where we can begin to rethink our food and rethink our drink. The myplate.gov and the Department of Agriculture is a federal agency. I've written it in my reference notes, but it's missing me now. But anyway, the MyPlate is a great way of beginning to start to reteach ourselves and rethink our food. Mr. West and I, years ago, he introduced me to this. Actually is a plate. Now it's mostly for the children to teach them how to reduce their food and their sugary drink intake. But this is very important for all of us as healthcare providers, as citizens, as private citizens, and us being able to teach these children so that maybe we can help reduce the obesity that I've been talking about. But there, I've got a link in the reference at the end, and you can go look at this website, and it's got recipes and it's got all kind of ideas on how to teach people how to work with this. And it has a lot to do with helping us know that we have got to do better about how we choose our food. Moving forward, are you pouring on the pounds? You're drinking 68 packets of sugar ingest 4 sugary drinks a day. If you're drinking any of the drinks that I have on this PowerPoint. There's sugar sweetened beverages. I had to go back. I had a conversation with my provider yesterday, and she had to remind me of stuff that I call myself alternatively drinking or using to sweeten my have a little sweet water or whatever. She's brought it to my attention, and I've got to begin to stand down, thinking that I was doing better. Beverages with added caloric, and there's going to be a difference. Beverages with added caloric sweeteners include soda and other carbonated soft drink, juice, sports, energy, and powdered drinks, sweetened milk or milk alternatives, and I'll have to do some research to find out if our almond milk is part of that, because I love it, sweetened tea or coffee and drinks. Then we have caloric sweeteners, which is a little bit different, because we're talking like I use the pink stuff, or I don't use it, but I use now the monk fruit. I'm sorry, I got to go back. Okay, anyway, I'll talk about it. So we're talking about sugar. We're talking about different kinds of sugar, honey, the sweeteners that they're telling us we can use. Oh my goodness, I lost my power. Hold on a minute. Let me see if I can get back to it. There we go. Fruit juice concentrate, cane sugar, fructose. They're pushing cane sugar is much better than some of the sweeteners. But according to what the healthcare providers say, all of it is bad for us, even if we're beginning to use different alternatives, agave syrup, corn sweeteners, brown sugar, all of those things that we think that we're getting away from a lot of sugar, we're still putting it in there. And then to blow my mind, because if I can't have any of this, I like to use Splenda to sweeten my water, not the little packets that you pour in your water, so they're supposed to be sugarless. She's saying no, because it tells your body that you have dumped sugar into your system, and it changes your DNA, and you still end up with issues with diabetes. So where I thought that I was doing better, I have increased my glucose, my A1C has gone up 2 points, just not using the sugar. So she's freaking out now, and so am I. So I just wanted to plug that in there, that we just need to maybe get some help. Asking people, they're sending me to a nutritionist if we can get that kind of help. If our populations cannot, they're going to have to come to the clinics and whatever needs to be done, but we've got to figure out how to help them. Okay, so who drinks the sugar? Who drinks sugar drinks on a given day? According to the CDC, children between men between 2 and 19 years old drink the most sugary drinks. And then those that are 20 and over are at 55%. So it appears that men drink more sugar than women. I don't know why. I found this and I thought I needed to share it. Because females between 2 and 19 drink 60% of the sugar. Their 60% of their drinks are sugary. And if they're under 19, and then if they're over 20, then they drink less. So according to this information, women who are 20 years and older are drinking less sugar. And then at this point, all together, half of their drinks are sugary on any given day. This is still in here. I'm sorry. I thought I took this out. Anyway, this was important to me while I was talking to children and parents, that we have target markets, and those target markets, the beverage companies see Latino, African Americans, and teens as a source for future sales. Therefore, Black children and teens saw 80% to 90% more ads than white youth that brought them to the level of them being targeted for having sweetened drinks that we should not have. Marketing for Spanish market TV is growing. Between 2008 and 2010, Latino children saw 49% more ads for sugary drinks and energy drinks, and teens saw 99% more. So I can only imagine those monsters and all that stuff that's really not good for them, is what they're being targeted for. Latino preschoolers are exposed to more ads than Latino children and teens. So I had that in there while I was teaching the kids. I thought I took it out, but now that's here, it's important that I share it with you so that we can get it to the parents and our leaders to help us with reducing the sugar. If we reduce it for our children, we also learn to reduce it for ourselves. So we're going to rethink our drink. There was Illinois Alliance to Prevent Obesity has this chart, and I thought it was great to use. And you think of a stop sign, red, yellow, and green. And this chart tells you what to drink, what not to drink at all, or have very little of it. The yellow, diet soda, lower calorie and 100% juice occasionally, and you want to not drink it the juice at full strength. I can't say anything about the others. I'm not a doctor, so I'm just gonna go with this. I'm not a medical doctor, forgive me. But green, drink plenty, water, seltzer water, skim of 100% milk. These are their recommendations. And I wanted to make sure that I showed that. Now, we're getting toward the end. Making healthier choices. If we stock our fridges with seltzer, unsweetened tea, low-fat milk, and other low-calorie drinks, we will reduce the sugar that we drink on a daily basis. I can't say how much, but I'm sure we could probably cut that in half. We can serve cold tap water during meals because tap water is delicious, clean, and free. We hope. Question mark there with Texas out there, y'all. So that was before all of that, but this is what I'm getting from the healthcare providers and the leaders, like the American Diabetes Association and everything. We need to read our labels, need to choose drinks with no more than 25 calories per 8 ounces. We need to add fresh fruit and herbs to our water because it kind of gives a little flavor, and maybe we won't have to have those alternative sweeteners. And if we buy fruit juice, make sure it's 100% juice. However, serve in a small glass or dilute it with water because that dilutes the sugar. Okay, so and then I thought I would illustrate that. I found this picture with these beautiful fruits in the water, and so I wanted to include that. All right, coming toward the end. I pulled this, what time is it? I pulled this, okay, I got it. I pulled this game to play, and so there's not enough of us here to play it, and that's cool because we're going to come bring this to an end. But I'm going to share this PowerPoint, and I'm hoping that you all will be able to show your students or your families or whatever. This was really the American Heart Association. Actually, I have a big poster of this, but they actually provided this, and it's a game that can be used. It can be used to help children. It can be used to remind us of when we go to the store and we look at something and go, oh, I won't get any of these. And so I'm going to give you the answers to this. It's going to be in the PowerPoint, but you'd be surprised about how much sugar is in each one of these drinks. We know this because we're healthcare professionals or professors or whatever it is, but the regular public does not. So this game really from the American Heart Association just really helps bring this home. So this is one, this 5 here, and then there's the other 5. I thought vitamin water was cool. I could drink that, I'd be okay. The little tiny container of ocean spray, it's really small, so surely you know it wouldn't be that bad for you. But here are the answers. Well, how many teaspoons of sugar are in each one of these bottles? And I'm going to say to y'all, I've had all these empty. When I go to teach the children sugar reduction, I actually take sugar out of a bag and I spoon it into these bottles so that they can actually see how much sugar goes in before the water or syrup or whatever it is that's going in. I do that for them so that they, you know, they get surprised and go, wow, that's crazy. But yeah, that's what I thought too. Here we go. So our sugar, our answers are our Coke. I think which one of these had the most? The Coke had 13 teaspoons, and then the Dr. Pepper, of course, look what they are. But what really took me out was that the little tiny 12-ounce bottle of Ocean Spray has 9 teaspoons of sugar, and that blows most people's minds when they see that. And so I just wanted to leave that in there and share it with you guys. All right. So in conclusion, there are agencies with strategies, and I was going to tie this together, but this one in here, to help address our lifestyles, and change as far as diabetes is concerned, change our mindset. The American Diabetes Association, the American Heart Association, the Centers for Disease Control and Prevention, and the Institutes of Medicine. I've got my information from there, so if you need us, we can provide information and help out with getting the resources or information to help our populations. The main chronic disease causing harm, as I've said, to reiterate, is heart disease, high blood pressure, and diabetes. Actions that can be taken: we can choose to use the My Plate to eat nutrition food. We can make great drink choices to reduce sugar intake. Our children are being targeted and need guidance. Serve cold tap water during meals and throughout the day. And we must do whatever we can to ensure that our families can win with healthy lifestyles. And that's the end of my presentation, ladies and gentlemen. Any questions?
I have a couple of questions, and I want to thank you and Mr. West for sharing this very, very important information with our student body and those that are viewing as well. A question about diabetes.
Yes.
So we know the story that somebody has I'm gonna say, I don't know the terminology, but it's a severe case of diabetes, and they have to have their leg amputated. Why is it always a leg have to be amputated?
Okay, so here's the deal. You have there's so much damage. Diabetes does so much damage, and I can get you a written synopsis to answer your question and send it to you, so you'll have it if someone asks you that question. However, when we encounter all that glucose in our system, it's like, as I've been taught, it's like taking a bag of sugar, opening your mouth, and pouring it down your throat. As it's going down, it's affecting your liver, your kidneys, your hearts, your lungs, all your major organs are fighting for you, especially your heart. And what ends up happening, it's going in, it's going down. Well, arteries get clogged. You also have issues with not getting enough blood to the organs, which is your feet and your legs, your knees. When you start to, because there's I put it like this, the body joints have certain, they have what they do what it's supposed to do, but that's not the words I need. But when you get to your knees are sustaining the upper part of your body. Your legs and your feet are supposed to be strong, but if they're not getting the blood that they need, and if your kidneys and your liver are trying to dump what they call, what I understand as a diabetic, I've heard is called a liver dump or sugar dump. And so if you're not getting all the nutrition that you need, if you're not getting rest, if you're not monitoring how much sugar you're eating, it's just spreading itself through your body. So when it gets to your kidneys and your liver and they're struggling, it goes through the rest of your body. Now, while you're resting, and I've found this too to be true personally, while you're resting, your body's trying to renew itself. But at the same time, your limbs are having a hard time. And if your heart can't get that blood to your feet, that's the first thing that's going to go. Did that make any sense?
Yes, ma'am. Thank you so much for that
You're welcome.
information.
Okay.
I really love the my plate and the drinks, the sugary drinks that really opened my eyes. But I have a question. So in in the public schools, we have the milk options. And they got
Okay.
all these different flavors. And
Oh, Lord.
little
Yes,
ones
sir.
go towards the chocolate and the strawberries, and they avoid the white milk.
Okay.
And so um, I know that wasn't on there, but I'm going to assume those flavored flavored milks have a high sugar intake
Right.
in within
I
them,
did
right?
have that for you. It was the milk alternatives or whatever. That's
Okay.
what, yeah. But now what Mr. Weston can probably step in too if I'm not if I'm not shortening it. But what happens is we go out to the schools and we try to talk to them. Well, COVID kind of shut that down for us. I didn't get to go out and see them, what their intake. We were trying to make sure that we'll add water to that. So there's like, they have these little water bottles. I'll give you an example. Oak Ridge Elementary will be a flagship in Leon County. They're the flagship for, you go and you look and you see, hey, how are y'all doing things? Or we have a contact there. But what happens is, they realized that was a problem and a lot of that was taken out. But now I'm going to tell you something that I know and I learned, and I was taught this as I was learning sugar reduction. When we, as parents, we have the ability to control what our children eat and drink when they're home. So if we as parents, and I've seen this, we don't like we get them get them kids up in the morning. You got to get them off to school, not post COVID, but be pre-COVID. A lot of them, the teachers had talked to me and was like, "Do you know you coming out here teaching these kids about the sugar? The parents are the worst. They're bad for the kids." And I said, "Why?" I said, "Because some of them are walking here with a Starbucks drink, coffee, a latte, or whatever." And I'm saying, we're talking about first graders, and they're going, yeah, like the parents are the culprits in a way, because we may cut it out here at the school, but if the kid is screaming and hollering on the way to school, I want the latte, and they want to shut them up, they're going to give them the latte. So they really are not helping us help them come away from that option. And so it proliferates it. So that I can see where you're concerned, you have that question. And so we have to continue to teach them that that's not good, but that's what they offer in the milk. Even now, when you pick the food up for the children that are homeschooled or Zoom schooled, that's like you said, the chocolate milk, strawberry milk, all of that's in there. And so we'd have to have a conversation with Leon County Schools and see if there's any way that they can reduce how often the children have that choice.
Yes, thank you.
You're welcome.
It wasn't a question in the chat. It was more like a statement to add to the, I guess, your sweetener substitutes.
Okay.
So your Crystal Lights, your what's the one that with the drops that you can flavor your
Yes.
water. I forgot the name of them.
I'm an addict
But
now, and I
those
thought it was okay. It's not okay. The doctor said to me yesterday, "No, doc, it's not okay." I was like, "But I got COVID and I was thirsty and I couldn't eat enough ice, drink enough water, drink enough liquid. I thought I was just gonna die from too much liquid, but I was always thirsty." And she's like, "Yeah, because your diabetes took a hit with the COVID. It exasperated it." And I'm like, "Well, okay, I'm just telling you, I'm not drinking sugar. Like, I'm not running out buying sodas. I was just, using a little Crystal Light." She's like, "No, no, ma'am. No, that's not what we're doing." So thank you for bringing that. I didn't realize I was creating my own problems, but hey, I mean, now I know and I got to do better. And as a person that's teaching people about healthcare, absolutely, I've got to come off that and just drink the water and be done with it.
Yes. My other question was, can't, not a question, but that statistic that you gave us by 2030, that was eye-opening and alarming to see that that's where we'll be by 2030 with the obesity rate.
Right.
So I
Go
guess my
ahead.
question is not so much a question, but a statement. So you do have people that are that really want to change their lifestyle with eating
Right.
healthier.
Right.
But when it comes to it, we all know that we've heard the story.
Right.
Healthy food costs too much. I'm just gonna
Yes,
get what I'm used to, what I can afford. And so
exactly.
that's like a deterrent from them really wanting to do better.
Correct.
But it goes to the mentality of that individual, and we don't know their financial
Right.
issues right now. So that may not be the option, but there are other ways that they can still eat healthy and not have to worry about coming out of their pockets and spending so much money on getting the fresh fruits, the fresh veggies, etc.
Right. We're gonna have to teach them, and I got my expert on here, but we're gonna have to teach all of us. Like I can tell you that, there's a food desert at my house, but there's food everywhere, and then trying to learn how not to buy certain things, which I'm good at not doing it. Even have the little one saying no snacks. Okay, thank you. I appreciate that. Thank you. Don't ask me for any. You remember you said that, it came out of your mouth. Because I had said no snacks, and I guess he decided, okay, well, since she's gonna act like that and be mean, whatever. You don't try me like that. So, like I said that to say, even in our homes where some of us are making decent money, we also have had a lack of being able to get the fresh fruits and vegetables. We can go in some of the stores, and I'm not gonna like put Publix out there, but if I'm going to some of the stores, and it'd be like, let me do the thing, Walmart, Publix. I'm gonna go to Publix simply because I do want my tomato to last more than overnight and stuff like that. I'm not trying to throw them under the bus, but if you pay less money for it, it's not going to last as long as it appears. But Mr. West, and out in the community and the food deserts and things, and matter of fact, the reason why I was hired was to go out and start to talk to the community about these food deserts. It opens your eyes to know that people are hungry, even though they have the ability to get the food. There's so many other things now with COVID that have to be taken care of, that they're still not going to have the mindset of going somewhere. You'll say they get the stimulus and say, who's going to say, I'm going to run out to Whole Foods and buy all the fresh vegetables I can get before the money's gone. No, there's going to be so many other things that didn't get taken care of. So their mindset still doesn't get to change very much, maybe shift a little. We have to begin to figure out how to help them. And one of the things that one of the key leaders that works with Mr. West and I said, we got to teach them to grow it. And we're going to have to walk through it with them. Go ahead, Mr. West.
Oh, no, I was agreeing with you. Yes, growing is definitely a good option, but also I challenge the notion that it costs to eat healthier than what we eat now. It might cost to eat to a certain level, but we can all stop drinking some of the things that we drink and switch to water.
Absolutely.
We can all do that. There's no, actually, you would save money if you did so. And then even with the fresh fruits and vegetables, it's not as good, or, well, I guess I prefer fresh fruits and vegetables also, but even frozen fruits and vegetables. And that's not expensive. So look at the sodium levels of the meat that you pick up. There's ways that you can change with what you're doing now. You'll be surprised if you just look at the labels and you take advantage of some of the buy one get ones and fresh for less. There's stores like that have affordable fresh or affordable healthy items.
Right.
So you just have to look at what's nutritious, Do a little bit of research. You know, everybody has OK Google now, and just make sure that what you're eating and what practices that you're doing outside of just your eating habits, what environmental factors that you are subjecting yourself to. All those small changes would create a communal or an effect over time. I think there's a question in the chat also. I'm sorry.
Okay. I for some reason I can't see my chat. I think the thing is.
How long does it take to see a decrease in your A1C once you change your eating habits?
Just from a personal level, it may take anywhere from 6 months to 6 to 9 months if you drastically just walk away from all of it. You probably can do it in 6 months and it'll drop by a few. I think it's supposed to be 6.75. It's supposed to be the doctors are happy, everything's leveled out. I think definitely know for a fact anything over 9, because mine was freaking out about 10. She's like, oh my God. So that's bad. Like they're looking at everything that wants to go wrong will go wrong. You'll have all kinds of, and you have to look this up, but you'll have all kinds of, your autoimmune system will begin to act up on you. And everything I said to her about what COVID did to me, she was like, yes, but your diabetes, because you were stressed out, your diabetes didn't help. And so just saying that's the professional talk, that's the medical doctor. So I'm not, going off the grid, but the medical doctor presented that information to me. And you think, well, you have public health education, you should know this, but you have different areas that you go into. So all of us have to remind each other. All of us have to present something different and in a kind way, not, oh, you're a diabetic, you can't eat that. You're a diabetic. There are some people, they're saying it's predisposed to diabetes. I had a couple of slides in here that I took out talking about the 4 different types of diabetes. I can pull it, but we're running out of time and I didn't want to do that, but because I shortened my presentation. But there's just so much that we cannot present here when it comes to this disease, but it is the silent killer, because you'll go along thinking that you're okay. And you're absolutely not. If you don't get that A1C check, you're not going to know that your body is dumping that sugar. And what she said to me yesterday, because I like the crystal light, my DNA is changing and it tells my brain that I just had a whole lot of sugar, and it dumps insulin into my system. And that's still just as bad. I didn't know it was dumping insulin, but that's just as bad as drinking the sugar. So that was a lesson for me. I thought I would share that with people here. I don't know if any of you have heard it or have had, grandparents or family members or whatever that have said that, but that was an eye opener for me.
Thank you both for sharing that information. I want to thank you again, Dr. Harrison and Mr. West, for sharing this information. This will not be the last time that we contact you all, and hopefully when things get back to what the new normal may be, maybe we can get you all to campus and do the demonstration with the sugar for college students who are hooked on the Mountain Dews, the 5 hours, the Monsters, etc., and the lattes and the Starbucks.
Yeah.
Do those presentations for them and open their eyes and let them see that you're not too young to be affected by diabetes.
Exactly. Well, you got 4-year-olds and 5-year-olds having tantrums over Starbucks. That's a problem. And I'm telling you, the teachers tell me that. I was like, whoa, that's over the top. Are you serious? Yes, that did happen. I was like, okay. And they walk in the classroom with it. So then teachers got to fight them to get it out of their hands so they can teach them. And then they spaz out. You got to get called to the school to come get your kid, because your kid is spazzed out on sugar. It's not a bad child. It's what you gave the child that morning that started the snowball down the hill, the avalanche, so to speak.
Yes, ma'am. Well, thank you again, Dr. Harrison and Mr. West. Eagle Nation, thank you for chiming in for Your Health Matters, the Black History Month edition. This will be a series that we will continue with the Department of Health and other health departments within these counties, these surrounding counties. So once again, you all stay safe. Be mindful of what you intake, beverage-wise and food-wise. Let's keep it fresh fruits, fresh vegetables, and water, because it's free. And there's plenty of it until it decides, hey, we're just gonna evaporate and there's no more water. But
Right.
let's stay safe and stay healthy.
Thank you.
And as Ms. Walker said, be mindful of those fruits too. You have to check the labels. Check, like I was saying, check the labels. They do have natural sweeteners, so just make sure that you're reading what you're eating.
Yes, read those labels.
Yeah, I appreciate y'all because
All
I learned all the time, but I learned, from you guys too. So thank you very much. I appreciate that. Thanks for having me here, and Mr.
right.
West, that's my hero.
Thank you all.
All right. Well, you all have a good evening. Thank you again.
All right. Take care,
Thank you,
everybody.
Dr. Harrison.
Okay,
Yes,
good
sir.
night. Thank you so much.
Good night.